Dr. Manning?
Yes.
Your coma patient, given the abysmal treatment she received at that facility, I couldn't help but wonder what other ways they might have failed her, so I reviewed her history.
Did you find anything?
I'm afraid not, but I do have one question. What time of day did you perform that neuro exam?
Morning. Why?
Well, sometimes traumatic brain injuries results in a patient developing irregular sleep-wake circadian cycles, so it's possible Teresa's become nocturnal. I suggest we try the test again.
Great. Mr. and Mrs. Hazing, this is Dr. Abrams, Chief of Neurosurgery. Do you mind if we perform one more test on your daughter?
Well, the EMTs from our new facility are on their way.
It should just take a moment.
Teresa, if you can hear me, please open your eyes.
I've asked her that 1,000,000 times.
I know. Just bear with me a moment. Teresa, if you can hear me, please move your eyes side to side. I'm sorry. I finished Teresa's discharge. As soon as her transportation arrives, we will get you.
There's a condition called locked-in syndrome. If your daughter has it, she'd be conscious, but she wouldn't be able to move her eyes side to side. She could, however, move them. Well, let's see. Teresa, I need you to move your eyes up and down for me, please. Up and down.
Did you see that?
What was that?
Teresa, if you can hear me, please move your eyes up and down again.
Oh my God.
What do I do? I don't know how long I can go without scratching.
Okay, I want you to look at your reflection and scratch the non-itchy side of your head. In the mirror, the image is going to be reversed. It's going to look like you're actually scratching the itchy side.
Oh, I see it. But how is scratching this side of my head going to make the itch go away on the other side?
Keegan, trust me, we know that you've been feeling this thing, but I just want you to consider the possibility that maybe, just maybe, that this itch isn't real, and no amount of scratching is going to satisfy it.
Well, then what the hell am I doing?
Giving your brain new visual input to override the experience you had 3 years ago so it can begin to rewire itself.
Okay, look, you're losing me.
By feeling yourself scratch one side of your head while you're seeing yourself scratch the other, your brain will be tricked and realize something's not right. Now, hopefully, that experience will force you to perceive a new reality.
A reality in which the itch doesn't exist.
So you say, but nothing's changing. And I feel stupid.
The exercise is designed to confuse your brain, so don't worry about that. Just keep scratching.
Like this? Harder? Softer?
Just like you're doing. Be patient. Yeah, give it a chance.
Keegan will be just outside.
You're doing great.
How long are we gonna let her keep scratching?
She's been dealing with this for, what, 3 years? I mean, honestly, Ethan, I don't know how long it might take.
If it takes. The phantom itch theory makes sense, but it's still just a theory.
Certainly don't want to give her any false hope.
Dr. Charles, something's definitely happening. The itch, it's less.
Keep your hands off me.
Hey, we're trying to help. We just want to take a look, okay?
What do we have here?
Dr. Choi, this is Ray Ochoa, who insists that there is nothing at all wrong with him.
That's weird. Charge nurse said he was found doubled over on the floor of a gas station bathroom, screaming out in pain.
I wasn't screaming in pain. Only gay-ass punks do that.
Ray, you might not be aware, but I'm a Navy flight surgeon still in active reserve. And Jeff here was an Army Ranger. Seen plenty of men screaming out in pain.
Tougher guys than me.
So, how about we take a look?
How about you suck me?
Ray.
Come on. Seen this movie before. Even when he says he has something lodged up his rectum.
Seriously?
See how he's hunched up on the gurney, trying to take the pressure off the rear end? Plus all the lip. The embarrassment makes them combative.
All right. Try again, X-ray.
Thanks.
Mr. Clark, what are we looking at? Mr. Clark.
Sorry, we have a safety issue. Everybody, please step out. Step out. Okay, thank you. Step out. Laura, hey, Laura, that's you. Security, over here.
What's going on?
Dr. Choi was right. There is something large in the rectum.
What is that, a gun?
He says he has no idea how the gun got up there.
All right. What are our options?
It's not gonna be easy getting it out. It's just past the sphincter.
Plus, the hammer's gone. So if there's a live round in there,
Seriously.
Could do some real damage. 22 single-shot Derringer. It's a big kick for a little gun.
So we work up a plan to get him to the OR. Page the surgeon on call.
Miss Goodwin, I think it'd be safer to do it here. Jeff and I both have weapons experience. We sedate him, try to slide it out. If we can't make it, then we call in surgery.
I'm in.
Should we call CPD?
Yes, we'll need enough body armor and gear to protect whoever's in there with him. And let's keep this area clear.
And I'll keep the cameraman away from all this. It's unsafe, and frankly, it's distasteful.
Thank you.
How dangerous is this? It depends. Haemophilus influenza B can often be contained with the antibiotics we're giving her now, but not always.
And if it's not contained?
It can cause hearing loss, brain injury, even death.
I've never even heard of it. How'd she get it?
Well, that is the question. It's part of the standard vaccination regimen. Is Shiloh vaccinated?
No.
Are any of them?
Type E is transmitted by saliva, which makes incidental contacts like Dr. Halstead and I not at risk, but any of her long-term close contacts are. We'll notify the school, but in the meantime, you'll each need to be immunized.
I'm not sure we want that.
Mr. Kane, I think it's
Your
very...
children are at serious risk.
We feel vaccinations pose a serious risk as well.
That is not true.
Doctors are about intervention, I get it. But left alone, the body has a perfectly good immune system. And once you start injecting it with foreign proteins and preservatives, you can't help but change that.
Right now, all our other children seem to be fine. And Shiloh's in there all alone. Can we just go be with her?
Of course you can. We'll send someone in to watch your other children. Thank you.
That's my cousin, Kiki. Hey.
Hey, your labs came back negative. No sign of infection or any immune deficiencies.
Great. Kiki's coming to take me on.
No, we can only release you with the permission of a parent or legal guardian.
Forget it, I'm still going. Kiki, which...
Deb! What's happening to her?
She's seizing.
Step back, step back. Deb!
3 milligrams out of van. Call radiology. We need to get her upstairs for a head CT now.
Out of in.
Okay, bro. Okay.
Ready?
Yep.
She's got a mass in her sinus, possibly a tumor. We need a biopsy.
Yeah, but look at the cross sections.
I don't understand.
Neither do we.
It's moving.
You feeling any pain, Deb?
No, it just feels weird.
Stop moving.
What was that?
I have a pretty good idea. Forceps and speculum?
Oh, what's happening?
Just stay still.
A cockroach. What?
I'll take another look at that CT.